It is effective on both menopausal women and those who had vaginal deliveries or those who naturally suffer from vaginal laxity. Today I want to say a bit more about the Femilift treatment for you because it's one of the equipments and treatments which has really been underestimated and is not recognized the value of it as much as it is effective. This is the robotic handpiece for the Femilift, and one of the questions that every patient who wants to have Femilift ask first is how painful it is. It is not painful at all. Scale of 1 to 10, I would say probably 2, just because you're going to feel something is happening. It's not painful at all. It is effective on both menopausal women and those who had vaginal deliveries or those who naturally suffer from vaginal laxity. And what we have over here is the robotic handpiece for Femilift, which it actually measures the depth of the insertion of the probe by a robotic measurement. So it is extremely easy to have a precise measurement of the vagina. And then there is a plate over here, because this is actually the covering plate, but the one which we use for the patients is exactly identical. There is a plate over here which creates pixelated CO2 laser, which resurfaces the vaginal wall. It is different with the treatments which just produce heat, because by just producing heat, hardly you can make any difference. This really resurfaces the vaginal wall. We have got another handpiece which we use externally as well. What is the requirement for this? A patient who comes for Femilift, we always say that they should have a clear pap smear. Before making your appointment, make sure that you have spoken to your midwife or your GP practice, because you can get it free of charge to be up to date with that. Have a clear pap smear test. We need the result of the pap smear, and you shouldn't have any active infection going on. If you are at the age which you get your periods, normally I advise to have it about after a week of finishing of the period. Just have your period, leave a week gap, and then a week after you can have the Femilift. By the time you're leaving here, you are going to feel a bit of tingling. Nothing more than that. It's not going to be hot, nothing. But during the week, sometimes during the week after, sometimes you feel the same thing because it keeps working. Sometimes you feel there is a bit of tingling there. Some of the patients who are not menopausal, they don't feel such a thing. The patients who are menopausal or other patients who are suffering from dryness in the vagina, after having the treatment, sometimes they say that we felt that we have wet ourselves and leaking of the urine. But that is the effect of this giving moisture back to the vagina. And it works for menopausal women and those who suffer from grade 1, 2 of the prolapse. If you have got mesh, if you previously had gone on the repair with a mesh, unfortunately, you might not be suitable for that. Either we need to internally refer to our gynecologist to approve that you can use it, or you should have a letter from the gynecologist who has basically done the vaginal repair for you to say that you can have the Femilift. Legally, we need that letter. Otherwise, there is no downtime, no problem with it. You just shouldn't have any sort of infection. Thank you.